Are there any other synergistic therapies that folk use alongside LDN for autoimmune conditions? We've heard about obviously LDN and CBD in oncology. Are there any other combinations that people are using?
Come tomorrow
I'll say that
to
for
the MS discussion. Globally speaking, it's very similar as far as synergy. Now, obviously, there's certain things with certain types of autoimmune conditions that are disease-specific, but what I have found over and over, if somebody is quote-unquote reactive, most of their reactivity is that their immune system is so incredibly complex, and the LDN's doing what it does with all the receptors that we've all talked about. And there's so many other receptors, either that get backdoor activated or that we're already, especially in autoimmunity, we're already either hypersensitized or suppressed. So things that are more global, such as appropriate vitamin D levels, are huge in calming down reactivity with LDN. I always use curcumin as the example because it's really more of a modulator than anything else, but there's other plant medicines that do that. And then cannabinoids actually are another kind of global one. But I'm sure those of us talking about autoimmunity will bring up other things.
John, I think a wee bit more of a sort of direct answer for that one I could maybe give from experience, what we see in practical. So as well as everything you guys have suggested, no one's mentioned omega-3s, which we all know is just sort of a baseline of everybody should be taking omega-3s. But in an LDN patient who's not taking omega-3s, you can often get a response by telling them to take omega-3s. So the LDN then starts working because they're taking those doses. Also things like alpha-lipoic acid and L-carnitine. We're looking at things like fisetin just now. I don't know if anyone's experiencing that, but some really good fisetin. I don't know what you call it. Okay, yeah, so I'll talk to you about that one later as well then. But, resveratrols, anything that's going to support the autoimmune process, to reduce.